cases come into our office, and currently 5 people are hospitalized. So with that said,
Can I ask you a question, Cindy?
yeah.
What's the age, roughly proximity of those people hospitalized? Or
For
demographic?
the most part, between 40 and 55. It is younger people. The highest number of cases that we're seeing come in fall between 30 and 49, and they're very sick if they are unvaccinated. Some are, some aren't. The ones that are not vaccinated have really been hit hard by this virus. It's almost 100% the variant. So it is the Delta virus that we're seeing whenever it is cross-matched through the state. The state's cross-matching with 4 different large laboratories, and it's near 100% Delta.
So if you test someone for the virus, then does that sample get sent to Madison or something that they're finding out what variant it is?
Right. So all of our, I mean, it depends. There are a number of labs throughout the state,
Yeah,
but
right.
4 of the largest main ones are being typed and cross-matched every day. And those are coming out almost 100%.
So every sample is tested for the variant?
No,
No.
the ones going to those 4 labs right now.
So why would they go to that lab to be tested for the variant? What
It's just the
criteria?
state just picked their 4 largest labs that they're using to double check what they're seeing come through. Each state in the nation has done that. They've picked certain large labs where the majority of the cases are being tested, and that's what they're finding.
I'm just curious though, what criteria, like if I got tested, what would pick my sample to go to these labs? They don't test all the
Depends on
tests.
where you go. So if you're using Exact Science, that could be any one of the National Guard testing sites. If you're, I
Like
mean,
I got tested in Kewaunee County. Let's say I
that
got tested.
depends on if Bellin sends theirs to one place, Purveyor
Okay,
sends
so
them
that's
to
just
another.
how the system
It's how
is.
the system is
Okay.
set up. We have no say.
Okay.
The state has no say. It's just wherever they're contracted through, but
Okay.
they're taking the ones that are the largest. So for instance, the State Lab of Hygiene, Milwaukee Public Health Department Laboratory, wherever Exact Science is in there. And there's one more, sorry.
That's fine. No, I was just curious. I didn't know if they were taking random samples from every area that's testing or just.
But a lot of these labs, like for instance, the State Lab of Hygiene pulls from across the entire state. So they're getting samples from every single county.
Okay.
So it's a pretty decent indicator for them that it's almost 100% Delta variant right now. There's a new variant out there. It is on the West Coast. We haven't seen it in the state yet, but it's just going to keep circulating. Yes, I think that is what it's called. So we'll keep an eye on that. Right. Yeah. As far as vaccinations, we continue to vaccinate every week. Our clinics are now going to be pretty set here at the office. So Tuesday afternoons from 1 to 4 and Friday mornings from about 8:30 to noon, we'll be offering vaccinations every week. That will be primarily Pfizer. I have placed an order for Johnson & Johnson. We have not been approved for that yet. Johnson & Johnson is in short supply throughout the entire nation. So we're waiting on that. I have no desire to bring Moderna in because we have done little, if any, Moderna. We had 2 clinics earlier in the year and that was it. So we're going to stick with Pfizer because it's the vaccine that we're comfortable with and that the majority of our people have received. Go ahead. About the booster. Sure. So the booster information that I can give you right now is the people who have right now been approved for the booster would be severely immunocompromised people. So they are people that are actively going through chemo or treatment of a malignant disease. They are people who are organ transplant recipients, HIV positive. We have bone marrow transplants, and there are 2 other very rare diseases that have been approved as well. But other than that, we are not giving much boosters. So that's why on the report that you received on Friday, we have 11 doses of booster that we've been giving because we have to screen out everyone for those. Now, President Biden has said that as of next Monday, the nation will be approved for the third dose. We have not gotten anything through the CDC, the state, or any other healthcare organization saying that. So we're going to continue to wait on that until we have full state approval. They're going to give us the very specifics as to who would qualify when and if that comes out. And then we would open those clinics up. So we can use those designated times. But if we do receive, a large volume of calls, we can certainly open up at the expo again. We have no intention of doing that now unless we're really seeing a need. As far as kids, we're still approved for 12 and up. 12 and under has not been approved yet. They say it's coming, and we're just patiently waiting for that. If and when that happens, we can certainly open up something to offer more scheduling times for the kids, probably evening clinics, so that they can come in after school.
I have a question. So like in a test, your test comes back and it's positive, but then it also shows negative. What is that? Is that a false positive or?
No. So you have, when you're reading a test result, it gives the person's name, it gives the actual test result. So it'll say positive, but then over in the next column is a reference range. Obviously you want your reference range to be negative because that's where you want everyone to fall. So if they do not fall within the reference range of a normal lab, it's going to say positive. That's the difference.
So there's a situation that occurred and there was a person that tested positive, and then 3 days later, there was a report that came through and there was a negative on there also.
Okay.
So
then you followed up with a third test. Two negatives will cross out that positive. That's how the state's guidance is for us. But I can't answer for you why one day they test positive and the other day they test negative. My guess is that the viral load in that person changed. So what we know about Delta variant right now is that in comparison to the other variants that came out earlier, its viral load is extremely high at the beginning, but it weans a little bit quicker. So they might not be shedding virus at day 8, 9, or 10 like other people did, but it's very high at the start. So if they got tested on day 1 or 2 or 3, they may test positive. They go in 4 days later, it may show a negative, but it doesn't necessarily mean that they weren't infected at the start. It's that viral load that they're looking for under that microscope that changes.
So I have another question. So why are we not trying to use like more rapid tests? So like there's rapid tests that nurses and doctors have to take to go to work. And I'm not going to beat around the bush. This is a situation that happened to our family. And my son has been testing positive quite a bit for COVID. So we did a rapid test. We did multiple rapid tests, and he has tested negative because one of his tests came back from his COVID test that was positive, and then he had a negative. And I know what the doctor is feeling, one of his doctors, because he keeps testing positive and he has no symptoms at all. So one doctor said, I've heard or has said this, why can't we use these rapid tests? They're given to the doctors and the nurses. So I'm wondering, is this something that like when you have these meetings with your like health department, you said you have them weekly, is this something that's being discussed, or is it because there's so much going on? I mean, there's so many tests. I didn't realize there's a lot of
hundreds.
Yes. And so this test though that we used was a test that doctors and nurses in Green Bay use, that they have to go to work on to test themselves so that if they are next to somebody that had COVID, they still can go to work and know that. And we used it multiple times and he was negative. And I presented this and one doctor said, I wish that we could be using this to get, that kids can stay into school because there are kids that that are
Well, there-
probably, are they carriers or are they,
There are rapid tests in the schools.
Right.
So the schools that are testing, all schools in the state of Wisconsin had the opportunity to sign up to be testers.
Uh-huh.
Okay. And the ones that are testing can use either a PCR test, which is the gold standard, or they can use a rapid. So they had that option.
Okay.
For instance, Algoma District right now chose to do testing. So any symptomatic child or staff in their school gets tested and it's a rapid test. What I can tell you historically about the rapid test and what we've been taught is that on asymptomatic people, it's less accurate. Okay, so your PCR, which is the original test that came out, it's the one that takes 48 to 72 hours for results, is the gold standard. It's the most accurate. The rapid tests have been less accurate in some cases.
So then the test that he had was not a 24-hour, it was like 6 hours. And he tested positive, but then his result came back negative.
It depends. First of
Okay.
all, it could still be a PCR and they can run it through.
Okay.
Okay. It's dependent on how quickly they get it to the lab, what the priority is that they put on it. So if he's getting it at a hospital, those are prioritized much different than someone who's stopping at a community-based testing facility, with a general cold. So there's a lot that goes into the testing, and I can't obviously
Right.
speak on the actual test. I haven't
Right.
looked at it. You know what I'm saying, but there's a lot of factors that go into it.
So in other words, which I didn't even know that it was an option in schools, but that.
Yeah. So
That
Kewaunee
schools-
had the option
Yep.
to bring in testing. They chose not to. Luxembourg Casco chose not to. More so because it's a staffing issue.
Yeah.
Right? Because then that ties up your one nurse who has to do the testing all day and they can't do the rest of their work, which is very overwhelming in small school districts that have limited staff for that capacity. Now, Luxembourg Casco chose to reach out to their community clinics and say, hey, if we have a positive or we have someone who's symptomatic that we think might be a positive,
Mhm.
can we send them over for some testing through you? So they've reached out to they're with Bellin. So, I mean, that's their contract for the school district. Every school district has that ability as well. So it's just a matter of those schools reaching out and getting their contracts in place.
Okay. So
And it's really no different than our agency has not chosen to do testing, because if we do testing, that eliminates the 2 nurses that we have to do everything else that we're doing, so we wouldn't be vaccinating anymore. We wouldn't be doing the other things because it's time consuming and it becomes overwhelming.
So when you're on these meetings with the health department, do they talk about some of this or?
Yeah. There's actual just full committees on just testing.
Okay.
Yeah. So there's concerns and there's questions throughout the state on methods of testing and types of testing. And I can't really even tell you the number of rapid tests is above 100.
Yeah. That's.
So is each one as good as the next? I can't be certain. I'm sure that they have to meet minimum standards, but to tell you, the one I know the most about is probably Bionox, and that's what our nursing homes and CBRFs use when they do their testing.
So if I could ask, is this new Delta variant, are there as many people that are asymptomatic, or they mostly have symptoms if they get the Delta variant?
They're pretty sick. Yeah. There's not a lot of asymptomatic people running around right now. We have people who have obviously been vaccinated in the past. There's a 20 to 25% breakthrough rate right now. And those people have basic general cold symptoms for the most part and recover quite easily. I can speak on behalf of my staff downstairs that some of the cases, and I think that they fall primarily between 45 and 60. We have seen people in and out of ERs almost on a daily basis, needing IV fluids, needing respiratory treatments. They think that they're going to die through the night because they aren't going to make it at home. And they're not sick enough to get into a hospital yet because the hospitals are overwhelmed. The ICUs are packed, and that's happening right here at home. Their staffing is very low. So the people who get this and get sick are very sick. Some have comorbid conditions. oh boy, I had several in the last 2 weeks that have not had comorbid conditions who really, really struggle with the past variants. By the day 10, they're feeling pretty much back to themselves, or at least on the road to recovery. These people have stayed on our caseload in excess of 2 weeks. Some of them are on 3 weeks. Some of them are over 3 weeks, and they're struggling.
And that's true with there's not enough nurses. There's nurses quitting. Well,
I think
it's across the board.
they're just burnt out. It's a lot. And you made it through that big hump, and we thought over the summer that it was going to get better. And now we're seeing it take a turn for the worst. And it's less hospitalizations and less cases right now, but the ones that we have are sicker. That's what they're seeing with this variant. With that being said, our vaccine is still kind of holding true with keeping severe illness and severe hospitalization rates lower, because the people who are vaccinated are not getting as sick. So back to my cases here, my report, we are at 45% vaccinated for our county. We continue to be about 10% below the rest of the state. The rest of the state is at 55%. We now have given 7,669 vaccines overall. So, and we're going to just continue to plug away at that. With the schools, there are cases in every one of our school districts right now. So yes, it's in the schools. They're holding their own. They have their own policies in place. And what our job as the health department is to kind of guide them through how to use those policies to maintain them being open as much as possible. We've also seen it in a lot of our parochial schools. We did have one parochial school that shut down last week, and our daycares have had some issues as well. We've had a couple daycares that have had to shut their doors completely for 10 to 14 days to try to combat that. So, it's out there, and we just continue to give guidance for those kind of things. Questions on COVID? Okay.
Cindy, I'm just going to let you go into the budget up. Oh, I'm sorry.
Do you have to do something special with that booster?
No, it's the
Shot?
exact same shot that you got the first
I
time
mean,
around.
for
us,
to keep it cold or whatever, like,
it's the exact same vaccine. So it's everything that we've been doing for the last year and a half. Yep. So we're good with that. All right.
Any other questions with that? Okay.
I wanted to give you, the next thing is a budget update. And I wanted to just give you a heads up on some further numbers that I got following our conversation last month. So I had given you the budget last month, telling you that further COVID money would be received from the government. And I now have definite numbers on that. So we are going to receive $70,000 for public health workforce enhancement. And that will go through June of 2023. And with that, we can increase our staffing in certain ways to help with some of the surges that are going on. So we have no definite plans for that yet, but we will look into it. I have an ad out actually to get some more contact tracers, because our contact tracers have been very busy recently, and our staff is backing them. So we're going to look at trying to get a few more people on board to do some contact tracing at this point.
You said till 2023, right, Cindy?
Yes.
Okay.
We are getting an immunization COVID supplement. So I think I told you that they told us we could no longer use the funding we were getting to do immunizations, which was the big push that we had. And that's where we were using most of our dollars. We now are going to be receiving $51,200 for immunization. And that will go through June 30th of 2024. And then finally, I think all of you are probably aware that there are ARPA funds that have been made available to the counties. So the county itself and all of our local municipalities are receiving ARPA funds, and then now the health department will receive ARPA funding as well. That ARPA funding can back our immunization efforts. It can be used for technology upgrades. It can be used for medical record type of things. Anything that we find a purpose for with COVID, we can use these ARPA funds for the most part. And that is 370,700, and that is available through December of 2024 for us. So we just received the official word actually this morning on those numbers. And I have shared those numbers with finance so that they're aware of them. These funds all are different than our other grants. Our other grants, we get a lump sum and then we use it up. These we have to bill for, and then they reimburse us. So, you know, we don't get the lump sum of $370,000 all at one time. It's a reimbursement as you go type of thing. Questions on those funds? All right. You want me to just keep plugging along?
Yeah, you can go right into your August report.
Okay, so you all received the monthly report for August. And on it, you'll notice that we did about 300 vaccines. We have a steady caseload for WIC. Our communicable disease numbers, we had 155 confirmed. So we've been busy with communicable disease as well. Majority of those obviously being COVID. However, we have seen a large uptick in Lyme's disease cases. So that is something that we're watching. And we've also had a fair amount of STDs coming through again. So people are returning to their normal behavior. Other than that, any questions on meetings or activities, anything that we attended?
How's the workout thing going?
Sure. Yep. That's going very well. PALS is in round 2. So we've started our second round of that, and it has a little bit lower attendance, but the people are very happy with it. The ones that actually completed round 1, I think, stayed in for round 2 to continue to build that strength. They really like the class. It is 3 times a week for 10 weeks. But the people that are coming out of it have definite changes in their abilities. So that's a good thing. We're also doing a stand up, move more virtual class, which is kind of similar, but you can do it from home online. And that has started as well and is going well. So Jess is leading both of those. We are in the schools right now doing school screenings. So vision, hearing, scoliosis, those kind of things are back and up and running. We will be in all of our public school districts this year, which is a change. Last year with COVID, we did not do those services because they were more or less in lockdown. But we have already started in the parochial schools, and that is underway.
And what about your back to school? How did that go?
Sure. I'm looking at Deanne.
We was 155 families that we served, and then there was over 350 kids that got backpacks, shoes, socks, hygiene bags. So it was very well received, and we're still getting requests from schools for new families that need help. So we still do have some supplies.
Okay. With that, we were able to give each school district some supplies. We also, we had a really nice donation from the Souls for Souls this year, which is the group that gives us the shoes and the socks. Well, shoes, and they gave us socks. But we had enough left over that we were able to provide each school district with a box of shoes and socks for kids in various sizes so that we could share with that, because we know that there are kids out there that go without shoes or socks. And so that was important. But actually, I think we had an increase in our numbers this year. It's the highest numbers we've seen, and the program overall went very well. We are in the middle of planning for flu season. So we are getting flu vaccines in. Our flu vaccine clinics will start soon. We will be at the adult health fair, which Aging will be hosting the first Thursday of October, the 7th. And so we'll be there giving COVID shots, flu shots, tetanus shots, all sorts of services like that. And then we have some other senior things that we'll be handing out as well. So we're ready with that. We also have reached out to our nursing homes, CBRFs, and schools, and are scheduled in those buildings to give flu shots too. With the bingo challenge that went on, I'm not sure if any of you follow us on Facebook, but you might have seen that going. We had over 90 participants in the bingo challenge, so it was very well received. They are handing out the gifts, I believe, this week because it is now complete. So they were very happy with that, and I think we'll probably continue it because it's been something that people can do on their own, but still have some motivation to get out and to move. So we're happy. And then finally, our CHIP, our Community Health Improvement Plan, Community Health Assessment is coming up. And I think I had told you that we were going to host it in October. We're reassessing that date simply because of the level of cases that we had coming in. And I think we're going to bump it back to November. Each one of you will get an invite to that. I encourage you to take part in it. We'll have some virtual options as well as in-person options to do that, but we're going to look at the various problems that affect local communities and see what you think our greatest issues are, and then continue the work on that for the next 5 years. And because we're a year late with that, we were due in 2020. State has extended us to 2021, so we're really hoping by December 31st that is complete. Questions for me on what's going on in our agency? All right. Finally, your financial report is in front of you. So that is for the month of July. It obviously comes out at the beginning of August. Yep.
I didn't have any.
Oh, here you go. Thank you. I think because I went to all those desks.
Okay. I'm like, I'm missing it.
But our spending is right on track with all of our grants. A lot of our grants are getting spent down and will be used up by the end of the year. The one that are pots of money that are not going to be spent down will be the county tax levy dollars. So we have supplemented in with our COVID funding for those. So you're going to see a lot less spending under the 54100 category and the 54106. Otherwise, everything else should be on track.
And with this other COVID money now,
Coming in.
it'll probably stay like that a little bit too.
Correct. Yeah, you're going to see that probably through 2024, that we will use as little county funding as we can and as much grant funding as we can, but with the understanding that we'll probably need it back after that. So, there's going to be a need in the future to resupplement those areas.
We'll see. We're not seeing it in the county paying taxes. We're seeing it in the federal.
Right. Exactly. Exactly. Any questions for me on anything?
Can we just go back to Lyme disease?
Yes, absolutely.
So I remember when that kind of first came out many years ago already. It seems like it hasn't been that long, but it's been quite a while. And they weren't aware of the symptoms and
Correct.
identifying it as Lyme disease in the beginning. I'm sure they've come a long ways since then. But what are the treatments and what are the side effects if it goes on undetected?
Sure. So Lyme's disease is something that is difficult to catch at the beginning because a lot of the symptoms are vague. So people will tell their doctor that they feel tired, they feel achy, their joints might be a little sore. I just haven't been myself recently. And then questions start about, have you had a rash? So the telltale sign of Lyme's disease is if they have a bullseye rash. Some people get multiple ones, some people get one, some people never notice it because if they're not doing a tick check, that might go unseen. But the entire state of Wisconsin is assumed endemic on ticks, which means that ticks are found in every single county in the state. And therefore, there is not one area of the state where they don't expect Lyme's disease cases. So when people are caught early enough, they will be put on a regimen of antibiotics and things that will then combat that, and they can return to a normal life. If Lyme's disease goes undetected, it's pretty significant. So it has some severe joint related issues with it, and people suffer the rest of their life with different forms of arthritis and things because it severely affects your joints. And in worst case scenarios, it can cause secondary heart block. So we see cardiac issues coming out of it if it's left undetected. So they run it quite frequently on people with those real vague symptoms because they can catch it early enough. So most of our cases are caught in those early stages. Not going to lie, I've had people go all the way to the cardiac level though. So, I mean, they're out there, it's scary. They try to treat this as quickly as possible. When someone goes in, they will draw a lab. And if it flags up as a positive, they run further testing called a Western blot. And that Western blot looks for very specific flags in their testing that is very definitive that yes, they do have Lyme's disease. So they're very specific in that testing and we watch it quite frequently. So these people have a fair amount of labs that come through to eliminate whether yes, it is an active infection or not.
Now, can they get tested and like, let's say they go in, they have symptoms and it comes back no? Have you seen that? And then they have to get tested again, that it takes a while before it's noticed?
Yes.
Okay.
Yep. They also have something called an equivocal test that comes through, which means that there's some evidence that there's something going on, but it's not significant enough. Those people will then be rescheduled for a test X number of weeks later to double check that.
That was a very good description. And I just wanted you to touch a little more in depth on that because it is something that's pretty significant. And, you know, many of us that like to go out in the woods and whatnot, I mean, you need to be aware to just at least check.
Correct. And that's why, you know, it does, DEET products are effective on ticks. So if you are someone who works outside, someone who spends time in the woods, hunts, you know, those kind of things, anything in long grass, basically ticks are around. My family was freaking out the other day. I was sitting in my backyard. I'm like, that's a tick. And they're like, how do you know that? And I'm like, because I see enough pictures of them. Trust me. So, you know, it was right there. So they're all over anywhere that there can be longer grass.
Thank you.
Any other public health questions? All right.
Okay. Cindy, I'm going to move to the travel request.
We have none.
Okay. Overtime?
We have none this month, I don't think. Our contact tracers right now currently haven't been working weekends. So minimal from our office, but everything is covered by the COVID grant.
And then we're going to go to next meeting, which I have down for October 11th at 8:30, if that's correct. And Deanne, right? October. Okay.
Down in the training room.
Yep. We're going to go down to the training room. So down to the lower level.
Not filmed.
Correct.
Okay. So then let's go ahead and make another one right away for November. So I'm looking at November 9th. That's correct with everyone. Oh, I'm sorry. November 8th. Yes, sorry. Would that work for everyone for November 8th on Monday at 8:30? All right, then we will go ahead with 8:30 on November 8th. Again, down below unless things change. Just want to remind everyone that there is no vets today, and that's for 5:30 before the county board meeting next week, Tuesday. Okay. So then, yeah. That is, I'm gonna say it's gonna be right when you walk into those main doors. That was not really given to me yet, but I'm assuming that is where it's gonna be, right when we walk into those main doors. If it's different, I'll let you know. And then we're gonna go back to jump over here. Okay, so we have our meeting. So any other matters at this time? Then do I have a motion to adjourn? Kathy, a first. Do I have a second? Julie, all in favor, say aye. Opposed? This meeting's adjourned at 9:08. Thank you.
Would you like to go? Did you sell your? Yeah, you hold it in the window, it should